mastitis is terrible. Besides all the other stuff, like making sure that your baby has a good latch and making sure that you are feeding on a regular basis and not allowing one breast to get too large and engorged. One of the things you can do to help prevent mastitis is lymphatic drainage. The lymphatic system is our waste management system of our cells. It helps reduce fluid. It's part of our immune system. And there's a lot of lymphatics around the breast tissue that we can help stimulate to keep everybody flowing. So I'm going to go over a fairly quick technique for you to do, and you can just do this daily. It should take about a minute. So when we do lymphatic work, we reverse engineer it, meaning we go from we kind of go backwards, right? So your lymphatic tissue dump into your subclavian veins. So this is your clavicle or your collarbone. The vein underneath that is where all that fluid dumps into the heart. So you want to start by stimulating this area. You can rub it. Okay. When you're doing a lymphatic massage, you aren't just rubbing the skin, like rubbing lotion in it, and you aren't like pushing down on the muscle. What you're doing is you're just sliding and gliding the skin over the muscle. 90% of our lymphatics lie just beneath the skin, so that's a nice area. So and it dumps kind of right into this corner, so you can rub that a little bit above and below your collarbone, and you can get out to your shoulder area. How many times? I don't know, 5 to 10. You can do it with your hands. You can do it with a dry brush. You can do it with a soft toothbrush. What you can also do is you can tap the area. Vibration is really important for lymphatics too. So after you've kind of cleared this area, bringing it back over here, then you're going to go to your armpit, and you're going to get your hand underneath your armpit, kind of where your bra is. That's another thing. Don't wear tight bras because that's going to decrease that lymphatic flow. So right in the side of the breast tissue here, and you're going to kind of do a pumping motion into the armpit, just kind of bringing this tissue up and just shoving it up in your armpit. How many times? I don't know, 5 to 10, right? You'll do that. Okay. Then you can add in a little bit of flowy stuff here, bringing it back. So now that we've cleared some of this and some of this, now we're actually going to take the whole breast, okay? We're going to take that and we're going to pump it up towards this area. It'd be great if we could pump it there, but there's no roads to do that, so we have to pump it over here first. So you kind of take that breast tissue, get underneath it too, so not having bra on is best, and then you're just going to lift it up in that area, literally kind of pumping everything through there, okay? 5 to 10 times. Right, then you can get back and do this, you can do this. There are some lymph nodes, just tiny ones, that go down the center too. So if you want to tap the center or kind of rub that area too, rubbing it back up towards the subclavian artery, that would be good too. So to recap, rub here first, pump here, pump breast, okay, and either tap or rub the sternum, okay? Give it a try.